Hi there. Welcome to part 4 of the low back therapy series. This next round of movement will be something that you could start to practice once you're into mainstream movement again. So once the back has kind of come back to neutral, you feel like you are moving at your regular pace throughout your day. Whether it's coming off of a significant injury and you've now been released from PT, or maybe you just threw your back out and you've gotten through your cycle of chiropractic care and you're starting to come back into movement of daily life. These few moves that you'll see today will be something that you could practice about 3 times a week in a span of maybe 5 to 10 minutes, and they should help you maintain some openness through the spine and through the areas in the low back and the hips. So you're going to start with a blanket, any kind of blanket or a low pillow, and you want to have about 1 to 2 inches of height. So you might need to roll that blanket, and I'm just going to show you why we're using that. Oftentimes when we're seated, particularly when we're seated on the floor, the tailbone tends to tuck under, and we have this rounding in our spine. So what I'd like you to do is take your hand to your low back, and if you feel your hand, your low back pressing into your hand, you would really like to be able to feel a bit of space. So you want that inward curve in the low back. And by lifting the spine up, you find that. But if we're super tight in our pelvic area, we may not have the room to lift the spine up. That's where the folded blanket or pillow come in. You can take that right underneath your sits bones, right underneath your pelvis, and you almost feel like you're kind of falling forward off of it. What that's going to do is give your pelvis space to move down so that the natural curve can come back into your low back. All right, so you'll start by being seated on a blanket and finding that natural curve in your low back. And you can take your right or your left shin forward to start in a cross-legged position. You'll start with your hands on your knees. Take a nice deep breath in, lengthen the spine up toward the ceiling. And as you breathe out, give some gentle outward pressure to the knees and start to hinge forward from your hips. Being careful not to round or drop down through your chest, but lengthen the center of your chest toward the front of your mat. If your right shin is forward, you'll feel this stretch primarily in the hip crease or the psoas on the right side, and then starting to wrap around the back of the outer hip. If the right leg is forward, walk the hands to the left. As you walk the hands to the left, press back gently through your right hip, and you'll start to feel a stretch coming from the top of your hip over the low back to the lowest rib. This area is the QL. It's a large muscle in the low back that is often tight. 3 to 5 breaths here, coming back through center, and then you'll switch the feet. So this may be not a natural cross for your feet, but it will help to bring you balance. Folding over, 3 to 5 breaths, walking in the opposite direction. So if left leg is forward, you walk your hands to the right and push back through your left hip. As you come up through center, plant one hand beside the hip and lift the opposite arm up. Reach to the sky and press the hip and rib over to the other side of the room as you reach. So my left hand is down. I'm reaching to the left and pressing back to the right. As I inhale, I'm going to peel my chest open. And as I exhale, I'm going to reach to the opposite corner of the room. Again, getting right across that QL. Inhaling and exhaling. Now about 3 to 5 of these. And as you come through your final one, just stay here for 2 or 3 breaths and notice that stretch. Coming back up through center, I'll take my right hand across my left knee and plant my left hand behind me to give myself a little kickstand lifting the spine. As I breathe in, my chest broadens and my spine lifts. And as I breathe out, I begin to twist, thinking about the right side of my belly twisting toward the left side of my belly. Again, 3 to 5 breaths here, and then you can just switch sides. Pushing and reaching, opening and closing. And then finally finding your twist. Coming right back through center, you'll take the soles of the feet to the floor and just grab hold underneath your knees. Still on your blanket, you'll find a deep breath in, broaden the collarbones as you lift the chest. And as you breathe out, tuck the tailbone toward your heels and round your spine. So seated cat-cows here, breathe in and breathe out. Just again, flexion and extension of your spine. Coming right back to center, find that neutral curve in your low back again, resting hands to knees, closing the eyes, and find 3 deep, full breath cycles. And then gently release that, and you can move on with your day. The next series that you'll see will be a series on the knees, which will get into the hip flexors, the quadriceps, the inner groins, and the outer hips. And from there, we'll move on to core. Hope you have a great day and you continue to feel well.